Autism is the most publicly known type of neurodiversity. Although autism is not the most common type of neurodiversity, it can be a vulnerability factor for developing other types of trauma-related neurodiversity. If you are not familiar with the concept of neurodiversity, please see our first video for a brief explanation and some examples. Autism is heavily relevant to genetic factors. That means that a person can be born with autism and since then they will be autistic for whole their life. The brain functions and neurological characteristics of autistic people are different from neurotypical people. However, remember that it is all about differences and not defect. Over the past few decades, different types of media, social media, and educational programs have presented a good amount of effort to increase public awareness about autism. As such, even if you do not know someone around you who live with autism, you probably have some typical pictures in your mind about autistic people. This typical picture usually includes an isolated, non-verbal kid who does not have any eye contact and spends most of their time with a private instructor or family member. Although this stereotypical picture can be true for some individuals who live with autism, it is not a precise picture of many other people in autistic community, especially those who are called as high-functioning autistic individuals. People who live with high-functioning autism can have a lot of social interactions and relationships and can be high-functioning in many of intellectual jobs. These people are still autistic and have the basic brain characteristics of other autistic people, but they do not have any intellectual disability. They also have the ability to mask their autistic characteristics and they can show conformity with the norms and standards of neurotypical society. In other words, they can mask their autistic characteristics and pretend to act like a neurotypical person in many social situations. However, even high-functioning autism can be associated with various invisible disabilities and suffering, especially when the autistic person has a trauma history. Many, if not all autistic individuals usually have some history of traumatic experiences. Trauma refers to any extremely stressful event or situation that is beyond our coping capacities. In such extremely stressful situations, our brain cannot digest the high level of stress. Such amount of stress can damage some of our important brain functions such as our mood, memory, concentration and many other psychological functions and social behaviors. Such painful experiences are called traumatization, and the person who is experiencing this is called traumatized. There is no certain or predefined list of traumatic events. Any stressful or unpleasant experience can be potentially considered as a traumatic event, depending on our neuropsychological sensitivity. For example, you and your friend may experience the same car accident, but only one of you may become traumatized because of having a higher level of neurological sensitivity to stress. So a stressful event can traumatize you if it can cause a high level of stress that is beyond your neurological tolerance. As such, when your neuropsychological sensitivity is higher than other people, a lot of experiences can be traumatic for you but not for many other people. This is why autistic people are very likely to have a trauma history, especially complex trauma. The term complex trauma refers to repetitive experiences of traumatic events or staying in traumatic conditions for a long period of time. Complex trauma is an expected experience for many people who have been born with autism. This is because of their higher neurological sensitivity to stress. Many events and experiences that may not be a big deal for neurotypical people can act like a traumatic experience for an autistic person. Also, this is important to remember that autistic people are very likely to be victims of frequent maltreatment, neglect, and bullying, and these all are considered as examples of traumatic experiences. Complex trauma can be even more expected for high-functioning autistic people, because their disabilities are mostly invisible for other people. For example, many neurotypical people in society can be really empathetic and supportive of those autistic people who have visible disabilities such as intellectual disabilities or communication disorders. These extreme types of autism are much easier to be diagnosed in early childhood, and the early diagnosis can help other people to be more sensitive and mindful of the autistic person in different social environments. However, when it comes to high-functioning autism, the neurotypical society may not be supportive that much. This is because individuals with high-functioning autism can mask many of their autistic traits in social situations. Therefore, they look like neurotypicals in many aspects, and they are expected to follow the norms and standards of neurotypical society all the time. Even their parents or teachers usually cannot notice their autistic traits, and consequently these individuals may not get the proper diagnosis until their adulthood. It means that their neurodiversity will not be validated for many years. As a result, in many social situations, high-functioning autistic individuals are under a lot of pressure to completely perform like a neurotypical person. But this is something that they cannot do properly because they are actually neurodiverse people, and they need their own norms and standards. Such misunderstanding can result in a lot of experiences of failure and frustration for high-functioning autistic people. And most of these experiences can be considered as complex traumatic events. The experiences of complex trauma can cause long-term and treatment-resistant effects on mental health and social life of people who with autism. These can be problems like continuous emotional pain, social avoidance and isolation, low self-esteem, depression and social anxiety, intrusive symptoms such as nightmares and flashbacks, and problems with concentration and attention. In addition, complex traumatic events in childhood can make an autistic person vulnerable to develop other complex trauma-related mental conditions such as dissociative or personality disorders. We will talk about these conditions in future episodes. This episode has a further sequel in which we will explain how to support individuals who are living with autism and have a history of complex trauma. If you are interested, please subscribe to receive our next episodes about autism, complex PTSD, dissociative identity disorder, and borderline personality disorder.